My private member's bill is C-277. It is a bill to create a palliative care framework for Canada. And essentially, we're trying to make sure that we have consistent access for palliative care for all Canadians. The assisted dying legislation that was brought in was studying the Carter decision. And the special committee that was put together to look at that concluded that if you didn't have good palliative care, you really didn't have a true choice. And so based on that and an all-parliamentary committee that existed the previous session that studied palliative care and came out with recommendations, my bill then is the culmination of that. It sets out defining what service will be covered, the training levels that will be needed for the different levels of health care, getting a plan to implement consistent access across Canada, which will be difficult because there are places that have nothing and there are places that are very remote, so there's some challenges to address there. And then trying to figure out what the right mechanism is to bring it forward. Is it to update the Canada Health Act to include palliative care as a covered service, or is it the Canada Health Accord that should be adopting it, or is it a specific government palliative program initiative? So there's some flexibility there, but essentially we need to do something to get a plan to have consistent access to palliative care for all Canadians. As the discussion started on assisted dying, I was given a book by one of the parliamentarians that's my seat partner called It's Not That Simple. And it was a book about all of the places that have implemented assisted dying and what the complications are and what the upsides are. And I began to see that where there is good palliative care, 95% of people choose to live as well as they can for as long as they can. And I thought, really, I would rather work on something to help people live longer than work on killing people. So with that in mind, I found out that there was this previous all-parliamentary committee and went and got the report, talked to the people that were involved that were still in Parliament. Harold Albrecht and Kelly Block in my party were both members of that team. And from there decided, you know what, this is a bill that will be worthwhile bringing forward, because either the bill will get accepted. Certainly the NDP are very supportive and have asked the question in the House of Commons and have said that they will support this bill. The Liberal government has said that there's $3 billion they've put into the budget for home and palliative care. And you know, the Minister of Health, Minister Philpott, has said she is supportive of palliative care. And so although there's no actual money showing in the budget at this point in time, and the Liberals did not accept any amendments to the assisted dying legislation that had to do with palliative care other than to continue to study it, I do think that bringing this bill forward will drive action, either by getting my bill approved or by having the Liberals come with their own bill to replace it.
And you're fine with that?
I'm fine with that. I mean, the ultimate result is to get consistent access for people.
When you said your seat partner, what does that mean?
Well, in the House of Commons, there's a seating plan, and so I'm seated next to Mark Warawa, who's the member for Langley, and he was very interested in palliative care and pro-life kind of approaches, and so he was the one that provided the book.
Okay, because I've heard, is he a Liberal then?
No, he's a Conservative.
Okay, so I've heard, and there's obviously a different term for it, but if you were needing to be away from the house, you're paired with a person.
This is a buddy system. This is a travel buddy thing.
Okay. So it evens out, like you're not there and that person isn't there, so you're both...
There are several outcomes they're looking for. One is to make sure that you're not voting disadvantaged. But I think the other hope on the part of the Liberal Party, they are way overspending their travel budget. And they are hoping that by forcing other parties to pair up with them, we would all be equally guilty together. That would be a potential outcome. We had a liaison committee, which is made up of all the chairs of all the committees.
Now, when you say over budget like that, is that travel to the constituency or?
Travel to do committee business, to gallivant around the world, to travel. I mean, I'll give you, for example, in the last 10 years, the parliamentary budget for travel has been $2.5 million for committees. The fiscal year started April the 1st. In the last 10 years, we've never spent the budget. It's always been 60 to 70% spent. between April 1st and June 1st, the Liberals spent the entire budget. And so they came to ask for a $1.5 million supplement to the $2.5 million budget. And instead of discussing how they could cut some of the line items where there were 10 members going from the committee and 9 assistants, or 4 members going and 9 assistants, still, an opportunity to cut. Canada Post wanted to do 23 consultations across the country. Really? So they decided to approve the $1.5 million supplement. And then several committee chairs said, well, we haven't decided what we want to do on our committees yet, and we may need money and it's not in there. What will we do then? And the chair of the liaison committee said, well, you'll come back for another supplement. So just totally opposite from how we would do things in business, where we would put our plans together and we would add up those plans, and if they exceeded the budget, we would all have to go back and take a look at what we're going to sacrifice and what we're going to trim off.
Yeah, it's the old joke, well, I've run out of checks, or, just get
Right,
more
it's
checks.
not a blank check, and I feel for the taxpayer when 100,000 people are out of work in the oil and gas sectors, being hit very hard, small businesses under huge pressure. I just think that's not the time to be doing anything except austerity measures for travel. You can video conference, you can web meeting, you can teleconference. There's a lot of ways of getting input without actually going there.
One of the things I haven't written yet about, I know that you had a news release out that you're supporting the SWIFT
Yes.
funding. Let's talk about that for
Good.
this video.
This is really important and really exciting for Sarnia-Lambton. It's essentially the federal government put $90 million in, the provincial government put $90 million in, and $90 million will come from the counties. And there are about 19 counties, in this Southwestern Ontario project. So within Sarnia-Lambton, we have areas where there are gaps in internet connectivity. And in some places they have nothing. There's just a hole. Sombra is a huge issue. They have interference on their wireless systems from the US. They have inadequate speed and data transfer time on Bell, and there's nothing else. There are places in Brigden and Oil Springs that are also underserved, a lot of the rural parts of the community where there are holes. And so this project will essentially put hardware into the ground close enough that the cost of hooking up to a good internet service will be affordable, between probably $1,700 and $3,200 a year for a sign-up, which, when you look at what the options are today and what some people are paying in Sarnia-Lambton, is a good deal. And it's a sustainable model in that by putting the hardware in place, the revenue then that comes will be used for the next run of hardware to run to where more customers exist. So,
is there a dovetail in this? I guess I should research it, but is there a dovetail in what Blue Water Regional Networks, Blue Water Power is doing? About their project? Yeah,
I think all of these things are complementary. There are also initiatives that are expected to bring some connectivities even earlier. Tech Savvy is working, Brook Telecom are working. A number of these private companies or independent companies are working as well, and was able to finish up the pay equity report. We came with a report on how we think that we will be able to close that wage gap between men and women. The Status of Women Committee submitted their report as well on gender-based analysis. And the happiest thing that I could say is I think I've got the hang of this political thing now, and by the time the summer announcements are over, I'll have brought about $60 million in federal funding to Sarnia-Lambton, which I think is exactly what I wanted to do when I set out, and so I think I'm starting to understand how to go do that.